Everybody, it's Dr. Eric Balkavage, and I'm joined by my co-host, Dr. Erica Riggleman. Erica, how are you doing today?
I'm doing great. How are you?
I am doing fantastic. And we are going to do a podcast. We're not having any guests today, right? So we're going to be you and me having a discussion, getting kind of, not that the guests were bad, but it's nice to just you and I have a topic and a discussion because we're typically on the same page when it comes to talking about thyroid physiology. And even though we get some great guests and some great content, I think it's always good to go back to our roots and what we talk about and get back to this kind of cellular perspective on hypothyroidism. So today, we've got a bunch of questions that I think we'll cover regarding maybe some topics that I talk about in the book, we've talked about on the podcast, and I think it'll be important topics for the listeners to understand so they get a better handle of when we're talking about cellular hypothyroidism and some of the other terms we're going to use, what we're really talking about. So I know you're going to be you're going to do a lot of the asking, and then we'll have a discussion today. So let's just get right into it.
Yeah, so I think one of the biggest topics we want to discuss, and obviously this is a big topic in your book, is going to be hypothyroid spectrum. And I think that when people think of a spectrum, they think of a sliding scale. And so when you talk about that in relevance to thyroid issues, what do you mean by that? And can you explain a little bit about, exactly what that means and what it may look like?
Yeah, so when we talk about hypothyroidism, usually we are talking about the cellular perspective because lack of thyroid hormone at the cells is really what triggers what we consider hypothyroid signs and symptoms. It's lack of thyroid hormone getting into the cells. So we talk about cellular hypothyroidism. So that's like one end of the hypothyroid spectrum. And then in allopathic medicine, and what most people are familiar with is when the gland doesn't work, and glandular hypothyroidism, like the gland cannot make enough thyroid hormone anymore, and they're diagnosed with primary hypothyroidism. And so those are the two ends of the spectrum. And they are, when we're talking about cellular hypothyroidism, we're at like one end, and we're seeing the signs, we're seeing the symptoms, but their allopathic physicians aren't really even considering that end of the spectrum. They're not even considering hypothyroidism until they actually have a gland that's fully exhausted and lost 90% of its function. So we think that's the end stage of a thyroid disorder. And so we talk about, first you have this cell stress, excessive cell stress that triggers what we call that cell danger response. That triggers thyroid hormone to be deactivated in the cells and in the tissues, and that can start to drive symptoms. And that can start with normal thyroid hormone levels in the blood. In time, that can trigger inflammatory mechanisms, and we can start to then trigger immune upregulation, and that can trigger the beginning of the attack on the gland. We call that the autoimmune process or autoimmune attack on the thyroid gland. And that's kind of like a hidden type of hypothyroidism where the gland's still holding on, but the gland's still being attacked. And part of the early phase of this, somebody asked me this on Instagram the other day, like, what happens if you have low TSH and low T4? What is that? That's kind of, we have the low end, we have cellular hypothyroidism, we have the beginning of the autoimmune attack, we move up that spectrum. As the inflammatory mechanisms occur, then we start to see inflammatory mechanisms actually causing a decrease in TSH production. And sometimes that's considered what they call secondary hypothyroidism to pituitary hypothyroidism or to pituitary hypofunction. And so that's like the third phase in the puzzle. And then the fourth phase of that hypothyroid spectrum is what we call that full-out glandular disorder, where somebody has glandular hypothyroidism, where a thyroid gland can't work anymore. And then the last phase, and I don't even really talk about in the book, but I call it the roller coaster phase, and you and I know that phase really well, which is when somebody finally gets diagnosed, they're in phase 4, they have glandular hypothyroidism, and then they get put on thyroid hormone medication, and then it's the roller coaster ride is I get my thyroid medication, I feel good for a while, but then I crash and my symptoms come back, and then suddenly you get a change in your thyroid dose, and maybe they feel good, and the TSH is going up and down, medications are going up and down, and they just continue to struggle. But many times because their TSH is back within normal range or low, they'll be told that they don't have a hypothyroid condition anymore. It's being managed, yet they're up and down with their symptoms, whether hypo or hyper, for months, years, or even decades.
Yeah, and I think that a lot of people who go to an endocrinologist or even their regular MD and get diagnosed with thyroid condition or hypothyroidism, it's in that case, there's usually two categories. It's either you are normal or you have hypothyroidism. And what you're trying to allude to is that there's many phases that lead up to that, and where sometimes you may be told that you're normal, but you already may be in, the first or second phase of a dysfunction already. And so, most people think that, they're healthy until they have a disease, but there's always a spectrum of that disease that they may be in. And often that's what we're looking at. It's not just throw you into the same bucket for the same treatment. And that's kind of what our traditional medical system is doing, is really just looking at that and saying, you're either normal, you have this, and if you are abnormal, you're going to get this standard treatment or these standard tests, instead of really trying to dive into there and really figure out, what's going on. And I think that leads to the next question, which is, you often see with people with the spectrum of hypothyroidism is that there may be other conditions that are involved in that. Why is it that you often see other conditions or other disorders go along or kind of tailing hypothyroidism?
Yeah, and a couple of things. First thing is, I'll backtrack to that other point where we were talking about that spectrum. This isn't unique to thyroid physiology, right? It is. We see that with blood sugar problems. We see somebody who's got normal blood sugar, then they may have some hypoglycemic episodes and some hyperglycemic episodes, but their fasting blood sugar is still normal, and so they get chalked up to something else, and then they start to see blood sugar start to rise, but it's still under the diabetic range. But we're seeing that their hemoglobin A1C is rising, and they may get diagnosed as insulin resistant or pre-diabetic, and then eventually the condition gets bad enough and they get diagnosed with diabetes, right? Same thing with cardiovascular disease or liver disease or adrenal function. So all these systems don't go from working great to diseased. They go through a phase of breakdown. And so for the listeners, thyroid physiology really isn't any different than that. It's always this kind of gradient or the spectrum. But the question you asked is, like, why do we see other conditions? Many times in the early phase of, when we're in that early phases of the spectrum where they haven't been diagnosed with hypothyroid yet, they will start to have other systems become compromised, right? They'll have adrenal issues. They'll have blood sugar issues. They'll have problems with detoxification pathways. They'll have hormone dysregulation. And they may not even be diagnosed with hypothyroid. They'll just assume that these are other non-associated disorders. And when they go to see somebody, TSH is normal, therefore you don't have a thyroid problem. And these are considered separate situations, totally unrelated, and each of those gets treated. But what you and I have seen in our practice and a lot of functional medicine practitioners is that these things aren't unusual. These are really quite common. And the reason for that is, if at the root of healthcare issues is we have excessive cell stress that puts us into that cell danger response, those cells that are starting into that cell danger response change their physiology. Instead of normal homeostasis where we get growth and development, normal hormone regulation, and normal detoxification processes, physiology in the body changes to a defensive mode. And so the systems that are less important to survival get reduced within the cell, within tissues, within the body in general, and the systems that are more important for cell defense get upregulated. So our fight or flight system gets upregulated. We see changes in cortisol regulation to be able to help regulate blood sugar really quick, to dump more blood sugar out into the system. And so what we see is that people develop, like I said, blood sugar problems, adrenal issues, gut issues, hormone dysregulation. We see those things start to become problems. And I don't think, at least early on, and you'll probably agree with me, that those aren't really the problems, but those are the adaptations to the excessive stress. And it's the body saying, hey, we're going to slow those processes down. We're going to ramp up the immune, the inflammatory cell defense processes. And patients then do actually have real problems with their GI tract, real problems with their hormone regulation, real problems with cortisol regulation, disrupted sleep. And we start treating them like those are the problems, and people struggle. They'll be, I've been treating this over and over and over again. Why isn't it getting better? Well, because that's the adaptive change, at least early on. If in time, it can become a dysfunction, a significant dysfunction, or that system becomes compromised. But early on, I really think what we see, you know, the adrenal fatigue or the dysbiosis or the irritable bowel syndromes or the sleep disorders, those are the adaptive changes, is excessive cellular stress. What's your thought on that?
No, I totally agree. I think that it's a natural part of the body isn't always at one level. It's going to go up and down and has to respond to things that are in our environment, which can't be looked at as a bad thing. We have to have that, or else we wouldn't be able to survive. We have to be able to adapt to our environment. There's always going to be changes of seasons and things, you know, changes in food amounts. That's a good thing to be able to regulate the, you know, your system to be able to adapt to change. But I think that when it's excessive and it starts to really regulate out of balance and you start to have abnormal symptoms, that long term that has a lot of effect. And that's where a lot of the symptoms come from that people associate with hypothyroidism. You know, eventually that GI tract is slowing down, and that's why we get some of the GI symptoms and we're tired and fatigued, but your body's trying to get you back on track. And that's, I know we've said this before on the podcast, we often ignore those little symptoms and we just want that quick fix. And it often isn't it isn't a quick fix at all. It's going back and looking at, okay, yes, you have these symptoms, but why is that happening? And asking that why. And so you termed that name kind of the multi-system adaptive disorder. So could you explain that a little bit? Like, is this what you're meaning by that all the systems have to adapt, and what can that present as?
Yeah, so like we might see somebody come in, they've got blood sugar regulation issues, they may have hormone dysregulation, they may have adrenal fatigue. And the issue is they often wind up with 4, 5, 6 different diagnoses, right? And they're trying to treat the adrenal symptoms. They're trying to change their blood sugar regulation by changing their diet. And they could be good ideas or good strategies, but then they get frustrated because those things don't work. Why am I still insulin resistant? I'm not eating carbohydrates. Why is my adrenal system not coming in? I'm taking the ashwagandha. Well, we need to understand, I think it's helpful for a person to understand that what they're experiencing isn't a mistake in the body. What the body is trying to do is say, hey, right now we're being chased by the proverbial tiger. We don't really want to be sleeping if we're prey, right? We want to be able to run and get away. If we're in a fight or flight state and the body's got an infection or it's toxic, that's not a time where we want to try and get pregnant, right? It's not a state of health of the body. And we really need to understand that what you're experiencing is your body's response to the excessive stress. And the other thing that's really important there is when we look at that, and many times I always kind of draw out what their multi-system adaptive disorder is. And you and I both use metabolic assessment forms where we look at different organ systems, and we could say to somebody like, look, you have excessive stress. This is triggering inflammation. This is triggering this danger response, which is triggering the thyroid hormone to be downregulated in the cells. That's causing your signs and symptoms, but it's also causing the GI tract to be downregulated. It's not going to function as well. You're not going to produce as much digestive enzymes. You're not going to produce as much hydrochloric acid. Your cortisol physiology is going to shift. Your blood sugar regulation, your cells that are under stress aren't going to bring a lot of glucose into the cells to make energy. So your energy production is going to be compromised, and you are going to start promoting more fat storage. What you don't have is necessarily 5, 6, 7, 8 separate conditions, but you have a body that's adapting to the excessive stress and saying, okay, we're going to shut these individual things down. And so what I think is beneficial to a person understanding that is, hey, my body is not screwing up. It's not attacking me. It's not doing this by mistake. It's actually a plan of attack to deal with whatever that threat and stress is. And when people understand that, hey, my body's not revolting against me, it's trying to protect the cells and the tissues, then it's easier to accept that I'm tired, I'm fatigued, I've got adrenal problems with my adrenal system. You should have problems with your adrenal system if you're under chronic stress, right? You should. If your body's in a state where there's chronic stress, your GI tract isn't always going to be in a state where you want to digest a lot of food, because it's trying to fight something. It's not saying, hey, let's stop and have a meal while this tiger's trying to eat us. It's instead saying, hey, we don't need to stop and eat. We need to get away. So I think that's more helpful for patients, at least in my practice, when I tell somebody, look, you have one issue, you have excessive cell stress. We address that. These things may all start to get better on their own. Some of them may need help getting back online, because when a system becomes downregulated or altered for an extended period of time, it doesn't always come back to normal just when the stress goes away. You and I have seen that both, is that sometimes you have to rehab those systems. You got to rebuild the GI tract, support the secretory IgA system, support good bacteria in the GI tract to help it and encourage it to come back to health.
Yeah, and I think the prime example of this, I just had a patient a few weeks ago who came in as a prime example of this. You know, she's going to all these doctors. She's seeing her ortho because she's got joint pain, and she's seeing a GI doctor because she's got IBS, and she's going to see her psychiatrist because she's depressed, and she's going to her endocrinologist because she's got thyroid issue, and she's seeing all these different doctors, and everybody is telling her that they're all separate entities, they're all separate issues, but really what's happening is that her systems can't adapt, and that's why each system is trying to do its part to adapt, and it can't. So each symptom is producing its own symptom, and you may be able to manage symptoms by doing that, but you're not ever going to get to a place of resolution if you don't address what's really causing the adaptive stress problem in the first place. So I think digging deep is really, really important to get that person back on track. And the other part of that, I would say, is, you know, the same patient was trying to system manage those problems. She was taking her antidepressant for her, you know, depressive symptoms. She was taking, you know, IBS medication for her issues there. She was getting cortisone injections. And each one of those is trying to suppress that adaptive problem. And I think that's, you know, we're not allowing sometimes the treatments that we sought out by traditional medical system to allow our body to adapt. And sometimes that's hindering the actual root cause of trying to resolve itself, is because, you know, inflammation is good to a certain degree, but if you're trying to suppress that inflammation and your body can't ever bring in the immune system and repair and recover, it's this vicious cycle that keeps happening again and again and again.
Yeah, I mean, you can hold the body down, but oftentimes what we see from people is when they take, you know, they're doing something like an anti-inflammatory, it does suppress inflammation, but it suppresses it quite a bit. And then they feel good. And then when they come off of it, there's a rebound effect, because now the brakes are off, and now the body's able to produce the inflammatory response. And so you have this rebound effect. And ultimately, if they never got rid of what was causing that danger response to begin with, it's still there. So when the treatment goes away, the symptomatology can come right back.
Yeah, absolutely. And I think that's kind of the downside to traditional medicine sometimes, is that, again, I think you've said it before, the whack-a-mole. You're just chasing symptoms with, you know, whether it's a medication, or instead of trying to get to the root cause, which, again, we've talked about all these things, whether it's diet, lifestyle, sleep, you know, good breathing, all of those things are things that can really help the body accommodate and really try to, you know, get to that root cause. I get it. People, you know, if you're in pain, you want to get rid of that inflammation fast, but then we have to ask long-term, like, is this working, and why are all these other systems not working, and kind of work on that root cause part of it. And I think that's really important.
Yeah, I think we have to make sure the listeners know that we're not advocating that you can never treat anything acutely. If you're in a lot of pain, you can treat something acutely, but it doesn't mean you don't look for the root cause issue, right? You can, if your thyroid gland can't make any thyroid hormone and you're that compromised, you might need some thyroid hormone, but you're not going to fix the problem that created the thyroid condition by just putting hormone in. We see that over and over again, but it doesn't mean you can't get some thyroid hormone while you work on the rest, so that at least you have some level of improvement. So there can be a combination, but usually it's either allopathic treatment and nothing else, or sometimes even in our model, we're saying, hey, let's try this functional natural approach. But we do understand that sometimes a patient is really in a dire situation and they need some immediate care, which allopathic medicine could give them some immediate benefit, but they got to be careful that as soon as that symptom goes away, because it's suppressed, doesn't mean the problem's fixed. And that's where they have to be careful, because a lot of times people are lulled into that situation where they think the medication has fixed the problem, I just have to take it every day. No, the medication's managing the issue. It may be inhibiting the natural defense response. And so you're going to have more compromise, more breakdown in time if you don't address those root cause issues.
Yeah, and I think that just bringing it back to thyroid issues, being hypothyroid, taking medication, and it doesn't even have to be medication, it could also be supplements sometimes. People taking that stuff can, make it almost feel like a Band-Aid, like you feel like you're doing it and I'm managing it very well, but there may still be things on the back scene that you may not be seeing. You may be taking thyroid medication and still be having stages of thyroid dysfunction beyond that thyroid spectrum that you're talking about, still have dysfunction going on even though you're taking the medication. Can you talk a little bit about how somebody taking thyroid meds can still be on that thyroid spectrum? It's not just because you're taking meds that it's completely good?
Yeah, so when somebody's taking thyroid medication, the thyroid medication is really geared towards normalizing the amount of thyroid hormone reaching the hypothalamus and normalizing TSH. But when the body has no, like in a low stress state, the hypothalamus, the peripheral thyroid physiology, those two things may all regulate the same. But when we have this excessive stress, there's really upregulation of thyroid conversion in the brain and actually a downregulation in the peripheral tissue. So sometimes we see doctors taught in guidelines that maybe, or telling their patient that TSH should almost be non-existent when you're on thyroid hormone medication so that the thyroid gland doesn't have to put out any thyroid hormone. The problem with that is as soon as the hypothalamus is supersaturated, that does a couple things. One, it upregulates your sympathetic nervous system, which increases your fight or flight system more, which could make you more symptomatic, create more insomnia, more brain fog, more anxiousness, more anxiety. And into the peripheral system, once the brain is flooded, it can actually accentuate what we call the deactivation of thyroid hormone, preventing that T4 and T3 from actually getting to the receptors inside the cells and triggering normal metabolism. If there is still some type of cell stress, the cells are already trying to deactivate it, and now you get another signal from the brain that the brain is flooded, and now it's almost like a double whammy. And sometimes we see people who are like, my TSH is as low as it's ever been, and I feel worse, and I'm gaining weight. My doctor says I can't be gaining weight if my TSH is this low and my T4 is normal. Well, you absolutely can, because the body is, A, it's got danger signals, so it's slowing it down from that perspective, and two, the brain's getting a signal that there's so much thyroid hormone in the system that it is trying to shut down peripheral conversion so that those cells don't become hyperthyroid, and you're getting this upregulation of the fight or flight system, which can actually be more problematic.
Yeah, so I think that what you're saying often, that more medication isn't always better, and that we have to get to the root cause and try to reduce the life stressors and the things that are causing that cellular stress. And often, you may tell a person on the podcast or a patient this, and they may roll their eyes and say, oh yeah, let me just reduce stress. What do you say to somebody who thinks that reducing stress is impossible, or it's impossible, you could never reduce stress in your life?
Well, A, they don't have to reduce all the stress in their life. B, you can absolutely change how stress impacts you. And then the third piece of that is when most people hear that, they're typically thinking about emotional stress. Like, well, what am I going to do? Divorce my husband? Am I going to divorce my wife? Am I going to kick my kids out of the house, right? And now is a super, super stressful time because everybody's kind of stuck together for an extended period of time. But the goal is never to reduce all of your stress. What we're trying to do is reduce the excessive stress load so that the body can get out of this danger response and start the recovery process. The big challenge is, and you know this from dealing with patients and in just everyday life, is that what's excessive stress to one person is different to the next person, right?
Mm-hmm.
And I used this example with a patient the other day, and I said, "Are you a runner?" And they said, "No." I said, "Okay, so I am. So I can run a marathon today. If I get out of bed, I'll just go run a marathon. And could you do that?" And they're like, "No, that would be way too stressful." I'm like, "Right, but it's not stressful for me." She's like, "Yeah, but you're trained." Right. My body has adapted to be able to do that. So it's an excessive amount of stress for her, but it's a stress. While it's a lot of stress for my body is adapted to it. And that's the key. The healthier you are, the more adaptable you are to your environment, right? The more adaptable, the more resilient you are, and the more able you are to self-regulate. And so we don't need to remove all the stress, nor are we ever going to do that. What we need to do is reduce the load to some degree so the body can start to repair and heal, and then condition the body so it can adapt to more stress. And in time, you see this, I see this, as they get healthier, they're able to do more, right? More exercise, more emotional, deal with more stuff at work with their family, and still maintain a higher level of health. But the people who are really compromised and they're already in excessive stress, you add a little bit more stress to them and they break down, right? Somebody comes in and sneezes, next day, they're sick and in the bed. Well, the same person sneezed in front of me. I didn't get sick. Why is that? Yeah. Was there bacteria there? Was there virus there? Sure there was. But my body said, hey, we can adapt to that. We can manage it. We can handle it. And I think what we see is, even though people who are chronically ill say, hey, I can tolerate a lot of stress, the issue is they probably perceive that they can handle a lot, but the reason they're broken down is because they really can't adapt to it.
And I think your body handles different types. Like, you may be able to handle a lot of emotional stress because maybe you've been training for that emotional marathon your whole entire life, but maybe a physical stress is something that your body can't, or maybe the immune system stress, which is why you get sick all the time. But, you've been preparing for that emotional marathon your whole entire life. You may have had things happen, this happened and this happened and this happened throughout your whole life. So I think even in the category of stress, there's different categories and different levels that your body can adapt to different areas, a chemical, emotional, physical type of stress. I think you have different adaptability even within those own categories.
Yeah, and in the book, and we've talked about this in the past on the podcast, I really looked at it like your level of fitness, right? Sometimes people don't like that term, but how emotionally fit am I, right? If I don't have a much emotional fitness, then when somebody yells at me, I'm probably going to get angry. I'm going to get upset, right? And that can ebb and flow. I think, I'm not sure if I talked about this on this podcast or another one. We're in COVID, go out for a run. I come running up near some people and they're screaming and cursing at me because I came within 15 feet of them. Yet, where was I going to go? I mean, I'm on a narrow path. Where am I going to go? Their emotional fitness was not very high, because they just absolutely lost it. And, a quarter mile later, looping around on a different path near them, they're still cursing and trying to berate me. And fortunately, my level of my state of emotional fitness was higher, because I was like, okay, it's their fear, it's their issue. But that's a sliding scale for all of us, whether it's physical fitness, whether it's our dietary fitness, whether it's our environmental fitness, whether it is our metabolic fitness, like how's our blood sugar, all those systems working, whether it's our sleep fitness, whether it's our respiratory fitness. I mean, there's a lot of what we call these fitness factors that make up health and wellness. And you can be really good at one, and you can really be bad at others. And so somebody might look at somebody who works out. I mean, we just see this on the news periodically. I don't watch the news very often, but you hear this, well, this really healthy person got sick or died, right? Well, what we have to redefine health, because somebody who's really truly has a high level of health doesn't die like that, right? They don't get severe disease process. Yeah, if they get hit by a car, that's something out of their control. But you don't see somebody who's healthy, who has really high health, develop cancer. There had to be something wrong in the physiology, a poor level of metabolic fitness to allow those abnormal cells to develop. As you were saying, hey, the immune system should have detected those things and helped clear them out, but it didn't. A healthy person, a truly healthy person, doesn't require high blood pressure medication, right? So we've got to redefine health. And I think that's one of the craziest things. We don't have a great definition of health, and everybody thinks they're healthy, but we don't really have a good idea of what that is. So, you know, people are like, yeah, I'm healthy. The healthy person got sick. So my suggestion for people that listen to our podcast, the people we take care of, the people who will pick up Thyroid Debacle and read it, even though it's about thyroid physiology, really a workbook for everybody. Because what we really talk about in part 3 of the book is these are the health and fitness factors, right? And what you should be focused on is raising your level of fitness in each one of them. You don't have to be an endurance athlete or a CrossFit athlete to be healthy, but you need to have some level of physical fitness, right? And if you're not a CrossFitter, or if you are a CrossFitter and you got this great physique and you can lift lots of weight, but you got IBS and high blood sugar issues and excess body fat, well, then you're physically fit. That you've done well on, but maybe you've neglected the other parts of that fitness wheel or health and wellness wheel. And that's where we have to put time and attention.
Yeah. Yeah. I think that even with the COVID going on right now, I think that's a prime example. I mean, you hear that there's factors that lead to somebody being more susceptible to getting it, you know, obesity, high blood pressure, high cholesterol, diabetes. All of those things are a sign that the body already couldn't adapt. And then you throw something against the immune system, and the immune system probably can't adapt to be able to fight it. I mean, we have strong immune systems. We should be able to fight. We get exposed every day to things. We should be able to fight this off. But you have to then step back and say, well, the people that are, you know, some of these people that are getting it, it's that their body couldn't adapt in the first place. And then you throw another stressor, because that's exactly what a virus is. It's another stressor. And there's always going to be new viruses. So it's not just the coronavirus. There's other viruses that can cause the exact same thing, that we have to say, okay, the best thing we can do is get our body able to adapt to different types of stressors, because the next thing could be an environmental stressor. It doesn't have to be a virus either. That it's all about that adaptability. I think that that's really crucial, and for people to realize that there's always going to be a new thing. The best thing we can do is get our body able to adapt and have that best fitness in the adaptability category.
Yeah, and you know, when we talk about, I think if people start to think about health from a simpler perspective, it's a spectrum, right? It's a gradient. And if you say, okay, you know, because somebody could say, I'm healthy. What defines you're healthy? Well, I don't take any medications. Okay. Well, that guy is an ultra marathoner. Can you do that? No. Okay. Well, then you don't have the same level of health, physical health that guy has, right? And so the definition, I think if we can get used to it, is saying, hey, that I am adaptable to my environment. Now, I'm adaptable to my environment, but if you put me in the colds of Alaska, I'm probably not going to adapt real well right away, right? I may get sick, I may get run down, because I'm not used to the stressors of that environment. If we take somebody who sits in an office every day, they may not be sick and they may be self-reliant in their environment, but now we ask them to go into a more toxic condition. We put them with less stress, or less sleep, more emotional stress, and they break down. So what we have to do is kind of look at this. The higher your level of the health means the more adaptable you are to your environment. If you can adapt to your environment, that means you don't need any medications, you don't need a lot of extra supplementation, you don't need any assist to get around, right? Then that's a good sign of health. You need to be self-resilient, which means you don't need anything else to support you, food, but you don't need medication to manage things. And that you can thrive in your environment, not just get by, but actually thrive in your environment. And if you think about that, adaptability, thriving, and self-resilience, and if you want to, that's kind of an average state of health. And then to go into a higher state of health means you can adapt into more even in more stressful environments, right? You take somebody who's not used to, maybe they, like today, I mean, what's going on now, they're able to deal with a certain amount of emotional stress. Now you add Corona, their job is compromised, they get at home, they're working at home, they got kids running around. Are they losing it super fast, right? Or can they take all of that in and adapt to it and still be happy, not sick, not run down, still a stable person? Or do they start to regress under that environment? If the person may have been healthy in their stable environment, but you put them in a less stable environment, if they can adapt, they're at a higher state of health. If they can't adapt, they're in a lower state of health, if that makes sense.
Yeah, no, and I think that, trying to reduce the stress, figuratively is the best, and then working on the things that stress the system out. Are you a big proponent of things that purposely stress the system to try to, almost like training the adaptability, such as, doing things like doing cold therapy, whether it's a cold plunge or cold showers, and then saunas, and maybe intermittent fasting, like challenging the body to become more resilient? Are you a fan of those things as well?
Yeah, I think some stress is good. They call it the hormetic response, right? When you don't have any stress, which is one of the concerns about putting everybody in a bubble and not letting them get exposed to the environment, then their resiliency goes down because they don't have that little battle. So you need some stress on the system. You want to have that stress. You want it to kind of subside because it's going to break you down a little bit, and then you can rebuild and be stronger for the next level of stress. That's what, like, physical exercise, I think it's the easiest thing to consider is, if you did never curl before and I gave you an 80-pound dumbbell, right? You'd be like, oh, I can't do that, right? Oh, it ripped my muscle. But if we gave you, 5 pounds at a time, working through that, break the muscle down, it's sore for a couple of days, but then you come back a week later and like, hey, now I can do 10-pound dumbbell. Yeah, that stress that we did create a little breakdown, but then your body responded and it actually made you stronger. So the same is true whether it's physical stress, emotional stress, microbe stress, right? Or environmental stress. We want it to ebb and flow a little bit so that we can adapt to it, recover from it, and become more adaptable, more resilient to it. So I don't think living in a bubble, not exercising, not being exposed to the environment is a good thing. I think we take small doses, adapt to it, and then we can take bigger doses and bigger doses and bigger doses of things and still be able to adapt and still be resilient. But that's not what's happening to the vast majority of us of people who are getting chronically sick, that they just keep putting more and more and more stress on the system. It's unrelenting, it's chronic, it's sustained, and eventually their body just can't manage it. It may not be significant stressors, right? It may not be something major, but it may just be lots of small stressors that are chronic and persistent over time that just causes the body to break down.
Yeah, I think you kind of touched on it. I think that's kind of the biggest thing that I'm concerned about with people who already have adaptability issues is that, they're being told, don't go outside, stay in your home. A lot of these people are wearing masks and gloves when they go out, so they're not getting exposed to, the normal microbes they would. Not to mention when you put a mask on, you're decreasing the amount of oxygen that you're really breathing in and really increasing the CO2 that you're breathing back in, which that's going to create its own stressor on the body, which then can make you less adaptive. So, it's a hard world that we live in right now because I see both sides of it. But, I also see that we're going to be creating new stressors, not just viral, but other stressors on whether that's financially, emotionally, and then physically from, wearing the masks and our immune systems that we, as a society could be dealing with for months on end as repercussions in people's health.
Yeah, I agree. And, for whatever reason, there's lots of discussion about what's going on and what's real, what's not real. But I think if we just step back and look at things logically, we're not going to address this virus or the next virus by holding ourselves up and just continuing to say, okay, everything's going to be another vaccine. We need to expose ourselves to some level, build tolerance, build up the body. I mean, we see what's going on right now. People are inside. They're actually actually starting to see people get really frustrated and get outside and kind of revolt a little bit. But if you're not exercising, you have more emotional stress. You have less activity, potentially less effective sleep because you're not doing much. You're watching more TV, more online stuff, and you're eating more processed food because that's what's available, right? The fresh food's harder to get today. I mean, I think I had to go to the Costco the other day and there wasn't an ounce of fresh red meat anywhere in the Costco. I mean, it was all processed food. So you look at the carts that people are buying more processed packaged food, which is what's available. And yet that's probably some of the worst food they can be putting into their body to drive inflammatory mechanisms and increase their stress, and then make them even more susceptible when they are told to go out and make them more vulnerable to things. So I'm hoping we'll learn quite a bit from this experience about what health really means, and what I'm hoping that people will start to say that, you know what, I got to take care of me. That's the best thing I can do, because the people who are most vulnerable, the people who already have these pre-existing conditions. So maybe if I make me healthier, really healthier, then I've got the best opportunity to not be susceptible the next time one of these things comes around.
Yeah, because it will. I mean, again, like I said, it's whether it's another virus, an environmental thing, there's always going to be something else that comes along, and the best thing you can do is just keep your body as strong and resilient as it possibly can be. And I do hope that it's kind of an awakening moment for some people to realize that, oh wow, that puts me at high risk. Maybe I need to reevaluate what I consider health, or who's been managing my health at this time, and help people take control of their health and look for alternative options. And hopefully they're listening to this podcast and maybe they'll get something great out of it and realize that that there's other things that can be done, and that maybe they need to look at different aspects of their life and realize that maybe I'm not adapting. I'm that person that's bouncing from doctor to doctor and doctor with all these systems, and maybe there's something bigger that's going on that I just can't adapt to.
Yeah, and when people are talking about I am healthy, the tendency is to look at diet and exercise as your health factors, right? And in reality, maybe you are, like we said, maybe you're doing well with those, but maybe you're not getting sufficient sleep. I know I did that to myself. Hey, I only need 4 hours of sleep a night. And obviously that didn't work out well for me in the long run. If you have poor respiration, that's going to create stress over time. So have you looked at your respiration? Have you checked it? Do you work on it? Do you work on emotional stress, like mindset? I mean, so many people are resistant to looking at their emotions and working on their thoughts and how they think and how they react to things. Again, it's one of the freest things. It's super free, right? It doesn't cost really anything to do that often. But I think sometimes we don't want to confront what goes on between the 6 inches of our ears, why we really think and behave a certain way. We don't really want to take a deep look at our habits. Like, I don't have time to do this. I'm super stressed out. Okay, well, let's maybe improve some of your habitual fitness. What do you do on a regular basis? I don't do anything bad. Okay, well, how much time do you spend on social media every day? Well, I don't spend much time on it. Okay, well, look at your phone because it'll tell you. Oh, it's 3.5 hours. Okay, that's 3.5 hours of looking at other people's lives and getting some emotional stress from that experience, and not working on your emotional stress. So you see how well everybody else is doing. You don't know if that's real or not. And then you can start to beat yourself up and create your own internal dialogue of, how unfortunate you are, or, how incapable you are of having this magical life that you see on Instagram or Facebook. And that's probably not real to begin with.
Mm-hmm. Just a prime example. I saw something the other day on Facebook's this lady had lost all this weight, and I'm like, great, she's working out, she's changed her diet, and then come to find out she put on there like, oh, I had gastric bypass, and she was showing the food she was eating, and she was still eating the same food, same everything, but she just had gastric bypass. I think there's nothing wrong with that, but if you hadn't saw that, you would think, oh wow, she's doing really great and she can lose the weight, and you're comparing yourself, but she went and had a surgery done to have
right.
that, so
and you're beating yourself up because you're doing the same thing and it's not working for you. So you think you're something's wrong with you, or you're doing something wrong, or how my body is just working against me. Well, no, you don't know that person's backstory and how real it is. You know, I think, what did I say? I was watching somebody and we were talking about their success, and the backdrop of where they were was beautiful. And then when they backed their chair up, it was just a fake facade, right? And I'm like laughing because you look at this beautiful view of this pool and all this other stuff. It was just a picture, but it looked really good. But when they backed up into it. So it was this fake facade. And I was like, oh, well, maybe they're not that. maybe they are. Maybe they're just in their basement and that's their fake view. And you could look at that and go, man, that person, they're doing this internet thing, man. They're crushing it. Are they really? Or are they putting that illusion out for a sale?
Anybody could have a green screen behind you and be on a yacht in the middle of the Caribbean and make it look like you're living the high life, but you never know if that stuff is real or not.
And we all have lots of stressors, right? And that's the thing. I had a call earlier today, and I talked. The person's got a lot of emotional baggage, a lot of trauma in their life, and I'm like, you're really not different than everybody else. We all have our story. We all have our baggage, but we've got to get you to understand that you're not super unique, that these things have happened to you. Everybody has a backstory. It's always a little bit different, but everybody's got some negative stuff in the background. What allows somebody to thrive versus succumb to that is how they manage it, how their mindset is, how they reposition it, how they kind of deal with it or reframe the story so they can move on. The people who have had those things and can't reframe that story get stuck in that, it's groundhog.
That's sometimes the hardest people to help, people who have had some serious emotional things happen to them and realize that it's not about devaluing what happened to you, but there has to be a way forward. You can't just stay stuck in that same pattern. You don't have to forget, but you definitely have to move past it if you're looking for, light at the end of the tunnel. If you want to get past it, you have to be able to accept it. And I think that's the hardest thing, is that some people just don't want to accept it. They want to stay in that moment. That's why they thrive on it. They want to talk about it all the time. I think they feel like if they move past it, then they're going to devalue it. And that's definitely not true. But again, every person has their story, has their emotion, it may be at different varying degrees, but those are the things that sometimes hold us back the most, is the ones that we won't let go of.
Yeah, we talked about that quite like a whole podcast on that with Veronique Mead, right? That people get stuck in the freeze component where they're just in that situation. They can't move out of it. And that's one of the biggest things that really prevents them from getting well. And they're searching for a supplemental answer or to fix that. And really the only way to get well is to deal with that. And unfortunately, in the short run, many times it's super uncomfortable to do, but in the long run, it's probably the best thing for overall health and well-being.
Absolutely. All right.
So what other topics do we want to cover in this one?
I think we've hit them good. I mean, we've talked about the adaptive and the spectrum. And I think that, we've talked about the stressors, and again, not all stress is bad. And I think that we've handled a lot of the questions that we were wanting to talk about.
So we'll kind of summarize this and wrap it up. For the vast majority of people who are listening to this podcast or struggle or know somebody who's struggling with chronic hypothyroid symptoms, if you have chronic hypothyroid symptoms, you probably are on the hypothyroid spectrum somewhere. Your allopathic physician is really trained for the end stage, right? That glandular hypothyroidism, but there's a whole spectrum before that where functional medicine shines and can help you identify that, and then help you with the strategies to actually address it and correct that. The second piece of that is, if you have chronic health issues and you have blood sugar dysregulation, adrenal dysregulation, and hormone dysregulation, and gut issues, you have multiple systems that become compromised, instead of thinking that as 5 or 6 different separate systems, think about what's going on with your body, that there's probably some level of excessive cell stress. It's triggering a cell danger response. Your body is adapting to that by increasing inflammation, decreasing thyroid hormone, and down-regulating a bunch of systems in an effort to use that residual energy to run the fight or flight system, to run this defense system. So while those things don't feel good, if you think about it like it's all one big puzzle, it's all the result of this excessive cell stress, and you put your focus on reducing that cell stress and increasing your fitness in the fitness categories, then that's the best strategy to getting yourself healthy and well. And people will always ask Eric and I, like, what would you do? Which supplement would you use for this, or what would you that? And we can never really give you a great answer because it's different for everybody. Everybody's stressors are different. How we're going to manage their stressors is different. Everybody's multi-system adaptive disorder is slightly different, although we see common themes. But the solution is really more about addressing the health and wellness factors, the things that are creating the stress and raising your level of fitness, more than it is the supplements. The supplements are a tool, but they're not the tool. So this is a totally different model than allopathic medicine. And that's sometimes where the frustration occurs. You listen to this video or listen to this podcast and then go talk to your medical doctor about it. They look at you like you have 3 eyes, because it's not the world they live in. And we learned that when we did the podcast with one of my patients who was a medical doctor. Said, hey, I didn't realize that there is this alternative universe that existed, functional medicine. He didn't even know what it was. And he's a well-respected, medical doctor, but he was never taught. He never really learned any of that stuff. And the other issue is, even in the functional medicine realm, sometimes we're knocking the allopathic paradigm of give you something for each sign, symptom, or condition and try and manage it. And we're just converting that to a supplemental form. And people wind up on 5, 10, 15, 20 supplements for years on end and think, well, this is the better solution. While we use the supplements to help, that's not our long-term solution. Our strategy is to get you to raise your level of fitness in those fitness categories, identify the stressors. We can reduce the stressors, increase your fitness. You'll be able to adapt to more stress later without it creating compromise in your health.
Yeah.
So,
absolutely.
Any parting thoughts for you, Erica?
I think that people need to reevaluate and see and really think about how well they're adapting. If you've got a short fuse, you probably have some emotional adaptive issues. If, you can't run to the mailbox without being extremely winded, we probably have some physical adaptive issues, and trying to break those components apart and really figure out which one is the worst to start with, and really start just slowly working on the little bits. It's not just about food and exercise. Those are the easy ones that everybody thinks about, but I think that there's all those other things that we can do to work on adaptivity. And I think that that's a great place for people to start.
Awesome. So a couple of housekeeping things. One, if you're interested in more about what we talk about in the podcast, I do have a book coming out called Thyroid Debacle that I co-wrote with Kelly Halderman, who's a medical doctor, which was a good partner to bring into writing that book, because she takes, she was medically trained, so she can tell that side of the story. And then we bring this functional medicine part into the story, and we talk about the allopathic model, this kind of new model that Eric and I talk about, the cellular hypothyroidism. And then we talk about strategies in the third part of the book. The book's in pre-order now, so wherever you buy books, Amazon, Barnes & Noble, any of those places, you can pre-order now. Go out and pre-order it now. Definitely make our publisher happy. Both Erica and I work with people. So if you have more interest in working with Dr. Erica or myself, you can find my information at rejuvegencenter.com. I'm on Instagram at Dr. Volkavage. YouTube with my Thyroid Thursday videos. I got to get back to doing more of those. Kind of took a hiatus while I was finishing the book. But definitely just go to my Rejuvegen Center website and you can find out more about me and working with me. And Erica, you guys have a fantastic practice, you and your husband, Evan. So why don't you tell everybody, give them a reminder of where you're at and how they can find you guys.
You can find our practice at brainandbodyhealthcenter.com. We also have Instagram, YouTube, as well as Facebook.
Awesome. And Erica, along with doing a lot of functional medicine stuff, they're really cutting edge and doing a lot of things in the regenerative world with chronic arthritic conditions and neuropathies and degenerative joint conditions. So if you're somebody, especially in that local Virginia area, to their practice, reach out to them. Some of that stuff is really opening our eyes as to what just some of these natural therapies can do, right?
Absolutely. Yeah. And our nurse practitioner is really getting, seeing some good results with peptides as well. So there's some really cool things that peptides can do in helping to kind of create adaptivity and from a natural perspective. And so she's seen some really good things with peptides as well in the regenerative side.
Awesome. So we thank everybody for listening to the podcast, whether you listen to it, whether you watch it on YouTube, share this podcast with your friends, your family, people you know who are struggling with thyroid issues. But really, you can share this podcast with people that have any type of chronic condition, because at the root of it, the solution for almost every chronic health condition is improving your level of fitness and all those factors we kind of talked about. So thanks so much for listening to the podcast, and stay tuned. We'll have another episode out in the next week or so.
Yeah, awesome. Thanks for listening.